Hey there. So one of the things today I came across was how long I can endure physical activity before breaking down and just having to go down and lay down and take a nap or just relax for a while. One of the things that I'm dealing with was parallel to when I was hospitalized for cancer. Was I had 3 or 4 of my vertebra with some spondylosis, stenosis, a couple bulging discs, and the symptoms present as femoral nerve entrapment. And when the pain increases, it starts to kind of slow down my memory recall, so maybe words will not come to me immediately. Generally, I know what I'm thinking about, but I can't think of the words to say. So that's a side effect. And they give me some 5% lidocaine patches. They'll do like branch nerve medial blocks, or maybe it's called medial branch nerve block. I think that sounds better. And then other shots are directly into my hip joints. And another set style of shots are trigger point shots into my glute medials. I don't know the full name for that to tell you how correct that is. And then underneath the glute medials, also my piriformis are affected on both sides. And then the last kind of shot they give me is an epidural directly into the spine, but it doesn't go into the spinal fluid cavity of my spine. It's just on the surface, and that generally helps for 2 to 3 weeks. And then 4 weeks after the epidural, I usually get trigger point injections into my glutes, and that helps for a while. But the epidural almost immediately allows me to use my glutes more, which fatigues them even faster and causes a different kind of pain for me. So it's kind of like this little vicious cycle of what do I heal and what do I gain endurance in next? And I'm constantly working at trying to rehabilitate the muscles against all of the neural impedance of the pain of everything coming right off of the spine down both legs. And it's not just not just one section of the leg is affected. It's both sides, the IT bands, the vastus medialis in the center. There's a couple of muscles in the middle of the quads that I don't remember the name of, but remembering medical terminology actually helps my brain, I think, by letting me try to remember most of the words correctly, and all the associations of medically how it all fits together. It also helps the doctors when I can tell them exactly where and what's wrong, or what I'm feeling, and they can make their diagnosis from that after seeing me so many times. So IT bands, all pieces of the quad muscles on the front, the both hamstrings will get like piercing, almost trigger point pain in the middle of them when I sit too long. Right now I'm sitting in a heated seat, which helps. It lengthens the time I can sit. I just got done shopping a little bit for groceries. I get a couple gallons of water each time I go, and food, because I like to keep food in my room. That way I'm not up and down stairs all day long. And then where the hamstrings meet the glutes and that bone, it feels like nerve pain, but it shoots. It's like a 7 or 8 out of 10. It's not something I want to endure. So it stops me, and then people might think I'm having like a seizure or something when that happens, because my body totally kind of like reacts just a little bit, and it looks like I'm, jumping to a reaction, or maybe like, not even a seizure, but honestly I don't have seizures, but it stops me in my tracks. It has all of my attention for that second that it pierces, and then I have to like figure out how to not move in that direction in order to avoid that pain. That's my update for today. Give me some questions in the comments if anybody has, any advice, or maybe if you want, you have a situation you're in. There's so much medical issue that I've gone through in the last 5 years. It's insane. So this is why I'm trying to give back and share to everybody, in order maybe someone benefits from my experience as well. Thanks. Have a great day.